to Medical Dialogues. I'm Roshnida. Let's look at today's health highlights. Delhi hospital slapped whooping rupees 1.5 crore compensation for sperm mix-up by infertility center operating inside the hospital. In the recent judgment, the NCDRC has penalized Delhi-based Bhatia Global Hospital and its doctors with a fine of rupees 1.5 crore for negligence while providing assisted reproductive techniques to a couple and resorting to unethical practices. Even though the couple gave birth to twins after going through Intra-Cytoplasmic Sperm Injection procedure, after conducting a paternity test, it was revealed that the male complainant was not the biological father of the babies. While holding the hospital and doctors negligent, the court also expressed its concern regarding unethical practices being used in art clinics and noted that art clinics are moving to donor gametes very early and also when not indicated just to increase the success rate of the clinic. Moreover, mixing of gametes and use of donor gametes is being done without the knowledge of the patient. Taking note of the blood groups of the twins and the complainants, the top consumer court held the hospital and the doctors negligent and noted that admittedly the blood groups of twins differ from their parents. One of the twins was AB positive, whereas the complainant number 1 was B positive and complainant number 2 was O negative. Thus, it is clear that due to the negligence of OPs during ICSI or IVF procedures, such disaster occurred. Holding the hospital and the doctors guilty of negligence, the Commission observed that considering the entirety, the instant case is of res ipsa loquitur, there is no need to prove the negligent act of the OPs 1 to 6. It was not a case of an error of judgment by the treating doctors during the ART procedure, but it sounds that unfair trade practices adopted by the OPs. They were pointing fingers to each other and everyone wants to shirk away from responsibility and liability. The NCDRC bench also addressed the arguments by doctors and hospitals who had questioned the authenticity of report issued by CCMB. It was argued by them it was specifically stated in the report as private case, no legal locus standi. It was also mentioned that this report is only for personal use and not for legal purpose. Referring to this, they argued that the tests were carried out at the back of them and as such the possibility of the alleged test being forged, fabricated and manipulated cannot be ruled out. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.